on average, blue counties are seeing about 10 new cases for every 100,000 residents, while red counties have more than 19 new cases. This is playing out in Louisiana, which this week hit the biggest single-day increase of COVID-19 hospitalizations since the start of the pandemic. As of Tuesday, nearly 1,400 people were in the hospital, an uptick from nearly 170 the day before. During that same time period, the state reported nearly 6,800 new cases, marking the second highest single-day case count this year. Currently, the state faces one of the lowest vaccination rates in the country, with only 36% of its population fully vaccinated. Joining us now, infectious disease specialist and the physician-in-chief and chief academic officer at Children's Hospital of New Orleans, Dr. Mark Kline. He is professor of pediatrics at Tulane University School of Medicine. And Dr. Kline, thank you for being on. Let's start with children. Are you seeing cases of children getting the Delta variant? And at what level would you consider the danger of that number growing?
We are seeing a lot of children infected with the Delta variant. We're being inundated by COVID, frankly. As of Monday of this week, we had just 4 children hospitalized here in New Orleans with the Delta variant of COVID. By the time I left the hospital yesterday, there were 16. And this morning, we have 19 inpatients, 4 in the intensive care unit. This variant is infecting children. It's making them terribly ill. And in some cases, unfortunately, it's killing them.
My God. So what do you need? What does the state of Louisiana need to do in terms of outreach? What do you need to be able to get through this? And what do you need people to understand?
Well, I think we need people to understand that what we're dealing with now is an entirely different animal than we dealt with a year ago. This Delta variant is very easily transmitted person to person. It takes only casual contact to transmit the virus. And then once infected, young people in particular are far more likely to fall ill and to end up in the hospital or in the intensive care unit. This can be a devastating illness for children. Vaccination clearly is the answer to what to do. We're in a low vaccination prevalence state, as you mentioned. Statewide, the vaccination rate is only about 38%. Fortunately, here in New Orleans, we're closer to 50%. But this low rate of vaccination here in Louisiana means that we're susceptible to a truly devastating surge. This has not peaked by any means. And we've tried just about everything we know how to convince people to get vaccination for their own protection. But maybe the fact that children are now getting sick and dying from this disease will change some minds.
So let me focus on that again and ask, if the vaccination rate does not increase, will schools become Delta variant hotspots because children don't get vaccinated and they'll be the ones who get it?
This is a real concern for us. We're worried that when schools open, this will just catalyze the epidemic. It brings, of course, children together in clusters in the classroom, and without masks being worn uniformly or there being any mandate for masks in schools currently, we're worried that this will really catalyze the epidemic and that our numbers will grow even further. This is literally something that is evolving and changing day by day, and it's not moving in a positive direction. Just to give you a little more context, with 19 patients in our hospital right now with COVID, that's double the number we had had at any time over the past 18 months. So this is on the way up. It's showing no sign of plateauing, and we're very, very concerned that it soon will outstrip our ability to provide care.
My God. Dr. Mark Kline, thank you very much. We appreciate your coming on the show this morning. We'll be staying on this story, especially as the Delta variant pertains to children. This could impact so much progress that has been made over the months in terms of getting kids back to school. And here we are now with it ripping through Louisiana.